And joining us on NDTV this morning is Fatu Camara, senior journalist from the Gambia, runs a news portal called the Fatu Network. Thanks very much for being with us this morning on NDTV. We want to begin by asking you about, what exactly has transpired. I mean, this is a extremely serious incident to have taken place, the death of 66 children. Can you break down the chronology of events for us?
Yes. Well, as a mother and for every human being, this is, of course, very heart-wrenching. It's very devastating. We know there were deaths among children, and there were concerns raised, especially from people who were at the hospital seeing children dying every day. And then concerns were raised, and then the Ministry of Health decided to do some findings to see what really was happening. So at first they thought it was some paracetamol, and there was a recall from paracetamol, and they had a campaign where they were going to homes and tried to get people to stop using paracetamol until the WHO got involved, and then they came out with this information that was shared today that is actually has to do with cough syrups that were manufactured in India.
Right. Some of the ingredients that are used are also used for brake fluids as well as antifreeze, and that is what is used as a thickening agent as far as cough syrups are concerned.
Yes, that's what shocked a lot of people, because that's used in air conditioners and also in car radiators. So if you put that in the bodies of children, that's why it was said that it was affecting their kidneys and also affecting their liver, because definitely stuff that is used for air conditioners and cars, I don't know how human beings can consume that.
Right. Is there any further clarity on, the batch, the particular batch that is linked with the death of the 66 children? Has there been, a detailed investigation? We understand that these are drugs now, of course, that have been taken completely out of circulation. But, what are the sort of checks and balances that have been put in place in order to ensure that anybody who's already picked these up from the counter isn't going to use them and cause further damage?
Well, right now, there's a whole lot of media campaign going on in the Gambia. People are posting the photos of the cough syrups on social media, trying to get everyone to identify which ones they are. And the government is also coming up tomorrow with some measures. The president has announced that he will be talking to the nation tomorrow. So hopefully when that happens, we will know what other measures they're taking.
Ms. Camara, also very important questions that are being asked here. Of course, at the moment, the Indian government has just clarified that, these are syrups that were sent only to the Gambia. They're not in circulation here in India. But, what are the sort of processes? What are the checks and balances that are in place? Is there some kind of a testing mechanism that is in place as far as the Gambia is concerned as well? Do you carry out any kind of independent, quality control checks and balances before drugs that are imported from other countries, India or elsewhere, are actually put into circulation?
Well, that is how it should be. The Gambia has what is called the MCA, the Medicines Control Agency. That is the agency that's responsible for looking into this medication to make sure that they're safe. But also India as well should be able to have that. For instance, in America, there is the FDA. The FDA will approve any medication before it leaves the country. So a lot of people were also surprised that maybe Gambia must have missed the due diligence. But how about India? Why is it that a drug like that would leave the country and be shipped to other countries? Because I'm sure you also have what is called an FDA, form in your country. So people were also shocked how that escaped them.
Well, absolutely. I mean, I think, the buck has to stop somewhere, and I think responsibility ought to be fixed for the lives lost. And these are just 66 documented lives. We don't know, how many more people have actually suffered perhaps irreversible damage to their bodies as a result of these drugs. So while, of course, questions are being asked of the manufacturers here in India, my question to you was essentially to understand that, are there several layers of checks and balances perhaps, that have missed this very crucial, slip up or whatever you'd like to call it?
But that's what they're trying to investigate. We know there is a MCA who is responsible for that, but how did it escape them? That's what they're trying to find out. That the executive director spoke today, but until now, we know there are two importers that brought them into the country. So they're trying to find out how they came to the country. Did the MCA, the Medicines Control Office, did they do their due diligence? That's what we do not know as of now. So the director spoke, and they said investigations are going on, and they will tell us. So we're looking forward to hear what they say.
Well, we will, of course, sort of track that investigation very closely, not just here in India, but also what the Gambia has to say, and, further if the WHO has anything to add to that. So, story that we'll track very, very closely. And thank you very much for joining us here on NDTV this morning.
Well, thank you.